Hello, I'm Dr. Brandt Gibson, and today I want to talk to you a little bit about the immune system and how it, in and of itself, can lead to peripheral neuropathy or can affect peripheral neuropathy. So first things first, infections have been shown to cause peripheral neuropathy in multiple different situations. We know, for example, that you can get HIV. And from HIV, you can actually get nerve damage that will cause peripheral neuropathy and a lot of times cause significant peripheral neuropathy pain. We know that the herpes virus can similarly cause damage to the nerves and cause significant peripheral neuropathy. There are certain types of bacteria that can cause peripheral neuropathy. For example, the bacteria from Lyme disease, some of the symptoms of Lyme disease is a form of peripheral neuropathy that actually can be problematic and so forth. So because a lot of these infections can actually directly affect the nerves, the immune system fighting off these infections can also cause nerve damage. Whether they're fighting off the infections and they end up damaging the Schwann cells or myelin sheath, whether they're fighting off the infection and end up injuring the dendrites or axons or cell body of the nerve, this immune response can cause nerve damage as well. That being part of it. So, okay, we got infections can cause peripheral neuropathy. Sometimes the immune response to those infections can cause peripheral neuropathy. You can also get an autoimmune disease process that in and of itself can cause the immune system not to fight off the bacteria or viruses, but to attack the nerves themselves. So maybe it's going to attack the cells the Schwann cells that create the myelin sheath. Maybe it's going to attack the nerve cells directly and cause significant damage to those nerve cells as well. So this is autoimmune disease, means it's a mistaken reaction to your own tissues, your own cells, in this case, nerve cells. So some common autoimmune diseases that could lead to peripheral neuropathy as well include rheumatoid arthritis and lupus, to name just a couple. But the other part of that is, in the process of evaluating peripheral neuropathy, we also look for inflammatory disorders to say, okay, is this an inflammatory type autoimmune disease? Some of the tests that we run for genetic neuropathy, we're again looking for these genetic markers for other autoimmune type diseases that could be causing this peripheral neuropathy. So it's important to understand that if you have an autoimmune disease, whatever the autoimmune disease may be, this could also be leading directly to peripheral neuropathy. If you have any major infections, uncontrolled infections, this could be leading to peripheral neuropathy. If there are certain medications that you may be taking for these infections or certain treatments that you may be going through for these infections that could lead to a toxic peripheral neuropathy. So it's a wide range. The immune system is actively involved in all the systems of the body, and in this case is actively involved in the damage to the nerves that cause the nerves to malfunction. This is Dr. Brandt